Hi, this is Dr. Green with Lake Norman Health and Wellness. I'm here to talk to you guys about another topic that I think may be of interest to you. And we're going to talk actually about something that we all worry about as we get older. Alzheimer's and memory loss. And we're actually going to talk about how do we reverse Alzheimer's. There actually are some studies that are showing that it can be reversed. Well, God, that's kind of neat because Alzheimer's memory loss, it can seem like a death sentence. It strikes out of the blue. There's no cure. That's what we're told. And we know genetics plays a role. We know that your diet and lifestyle, though, also plays a big role, which means you can do something about it before the damage is too great. Now, there was a study that was recently done. It's the first of its kind. It looks at the ability to reverse Alzheimer's with lifestyle changes alone. So 9 out of 10 patients reversed their memory loss, showed considerable long-term improvements following a program that included dietary changes, exercise, supplementation, sleep improvements, and brain stimulation. Some were able to actually return to jobs that they had to quit due to declining memory. Only one patient with late-stage Alzheimer's did not improve. It's the first study to suggest that memory loss can be reversed and that the improvement can be sustained. The research was inspired by studies that looked at the effect of diet and lifestyle changes on other diseases like cardiovascular disease, cancer, or HIV. In the study, subjects reversed their memory loss through approaches that included eliminating all simple carbohydrates that led to weight loss, eliminating gluten and processed foods, increasing consumption of produce and non-farmed fish, yoga and other stress-reducing activities, increasing sleep from 4 to 5 hours a night to 7 to 8 hours a night, taking vitamins like B12, D3, CoQ10, fish oil, curcumin, resveratrol, ashwagandha, or coconut oil, a minimum of 30 minutes of exercise 4 to 6 times a week, cutting out snacking, and hormone therapy when necessary. The biggest obstacle in the program was the study subjects complained that they didn't want to make so many changes. But all but one experienced notable improvements without the side effects that drugs bring. It's important to note the reduced consumption of carbohydrates in the study. Some researchers have called Alzheimer's type 3 diabetes due to the deleterious effects of excess sugar and carbohydrates on the brain. Exercise is also a fairly potent magic bullet. When it comes to brain health, regular exercise has actually been shown to positively affect memory and help reverse memory loss. Sufficient sleep is necessary to protect a healthy memory. The brain waves produced during sleep help us store memories. These brain waves actually transfer memories from the hippocampus, it's a part of our brain, and it's where short-term memory is held, to the prefrontal cortex, where long-term memories are stored. Lack of sleep, poor quality sleep, disrupts this process and it leads to memory loss. Gluten and other foods which we may have an immune reaction against can cause memory loss by inflaming the brain. Although most people associated gluten intolerance or gluten sensitivity with digestive symptoms, the reality is gluten most often affects neurological tissues. In fact, only 13% of celiacs, that severe form of gluten sensitivity, have gut issues. The other 87% do not. Sometimes simply going gluten-free can significantly improve brain function. Ask my office for more ways you can support your memory. Also, for which supplements can help support your brain health. Call 704-987-3993 and schedule an appointment with myself, Dr. Green, today.